Thank you, Chairman Clyburn and Ranking Member Scalise, and thank you to our witnesses today. Ms. Lawley, I want to also extend my deepest sympathies and condolences for your loss. Honestly, it sounds like some potential malpractice in that nursing home, and I'm hopeful that your state inspectors are notified and digging into that. By now, it's become clear that elderly Americans are at a much higher risk for COVID. According to the CDC, 8 out of 10 deaths reported in the United States have been in adults age 65 and older. Tragically, residents in nursing homes are particularly susceptible. According to CMS data, as of June 10th, as we've said today, there have been 95,000 plus confirmed cases among nursing home residents, 58,288 suspected cases, and 31,782 deaths. Due to the great risk COVID poses to nursing homes, the Trump administration's coronavirus task force has taken protective steps at the onset of this crisis to protect nursing homes, residents, and workers. In early March, the administration advised nursing homes to suspend all medically unnecessary visits to help slow the spread. The administration also prioritized the shipment of PPE and supplies to these facilities where they were critically needed. As of June the 3rd, FEMA had made 9,262 deliveries of medical supplies to nursing homes in 50 states and 3 territories. Additionally, FEMA is currently coordinating 2 shipments that total 14-day supply of PPE for all 15,400 Medicaid and Medicare certified nursing homes. Many states have stepped up to the plate as well. My home state of Tennessee has been working night and day to protect our most vulnerable neighbors. In March, the Tennessee Department of Health began requiring all nursing homes to alert state health officials if they detected 2 or more cases of the coronavirus among residents or staff. In April, the department rolled out an hour-by-hour action plan for nursing homes to help stop the spread and mitigate outbreaks. Unfortunately, not every state did it the right way. Some states completely failed their nursing homes. And of course, we've talked about New York being a prime example. Other members have already hit the failure of several governors to follow CDC guidelines and President Trump's task force guidelines and the resulting deaths. And I'd like to take a few seconds and quote some of those leaders, some of those governors, overall flippancy about the virus in the first place. In February, despite the coronavirus spreading across the globe, Governor Cuomo blatantly dismissed the coronavirus and told his state citizens, and I quote, "Catching the flu right now is much greater risk than anything that has anything to do with coronavirus," end quote. The mayor of New York City, the clearly ground zero for the United States, Bill de Blasio, followed suit and tweeted on March the 2nd, that's a full month and 3 days after the president closed travel from China. Mayor de Blasio said, and I quote, "I'm encouraging New Yorkers to go on with your lives. Get out on the town despite coronavirus," unquote. And then suggested residents go to the theaters and the movies. Nowhere was this nonchalant attitude more deadly than in New York's nursing homes. On March the 21st, the state told nursing homes that it didn't need to test symptomatic residents. That led to overall testing ending in those nursing homes completely. Later in March, New York ordered nursing homes to admit patients regardless of their COVID-19 status, which was a recipe for disaster. Many New York nursing homes were self-reporting an inability to safely take in those residents. The state effectively forced understaffed nursing homes to violate CDC guidelines. Further, the state actually prohibited nursing homes from testing a resident for COVID-19 prior to admission. This wasn't just bad leadership. That killed people. Governor Cuomo didn't reverse his order to force COVID patients back into nursing homes until nearly 2 months later, as has been said. Other states like Michigan still haven't reversed that order today. As a result of the volunteer states' proactive steps and New York's failures, you can see the disparity. Tennessee has 12.1 coronavirus cases per 1,000 nursing home residents, while New York has 111. We've had 3.6 deaths per 1,000 nursing home residents, while New York has 43.9, over 12 times as many. These aren't just statistics. These are human lives. The vast majority of the deaths in this nation are elderly, with the vast majority of those elderly dying in nursing homes, and the vast majority of those dying in nursing homes in the 7 states who blew off the CDC and the president's task force. That paints a pretty clear picture of where this committee needs to direct its oversight microscope, and I hope we will. A quick question for Mr.
Mr. Green, you've exceeded your time. I will allow this one question, but you've exceeded your time.
Thank you. Just a quick question for Mr. Crepin. Any reason why the Michigan governor won't reverse this? I mean, her colleagues, her fellow colleagues, other Democrat governors have reversed this bad decision. Why is she continuing?
Well, she's in a little bit of a political sort of tug of war with Republican legislators who want to revoke some of her emergency powers, and she seems to be holding up altering the nursing home policies as sort of part of that back and forth would be my best guess. I don't think there's a very good policy reason.
Thank you.